Have you ever wondered why diabetes is considered one of the most persistent health issues globally? This is because diabetes is a widespread phenomenon, affecting hundreds of millions of people around the world. It's not just a disease, it's a global health crisis that impacts every aspect of an individual's health, from heart disease to kidney failure and even blindness. Understanding diabetes is not just about knowing the disease, it's about understanding the impact it has on the people living with it and the burden it places on healthcare systems worldwide. The key to managing this disease effectively lies in understanding it thoroughly. The good news is, despite its complexity, diabetes is manageable. With proper knowledge, lifestyle changes, and medical intervention, it's possible to live a healthy and fulfilling life even with diabetes. So, let's delve deeper into the world of diabetes and demystify this complex health issue. So, what exactly is diabetes? Let's dive into its core to understand this prevalent health issue better. At its simplest, diabetes is a chronic disease that impacts how your body uses the energy derived from the food you consume. The food we eat gets broken down into glucose, a type of sugar that our bodies use for energy. This glucose enters the bloodstream and necessitates the presence of insulin, a hormone produced by the pancreas, to act as a key to open the cells, allowing glucose to enter and be used for energy. However, when it comes to diabetes, there's a glitch in this process. This glitch revolves around insulin. Either the body doesn't produce enough insulin or it doesn't use it properly. In the case of insufficient insulin production, the glucose can't enter the cells efficiently, leading to high sugar levels in the blood. On the other hand, if the body doesn't use insulin properly, a condition known as insulin resistance, the pancreas tries to compensate by producing more insulin. Over time, this overworking of the pancreas can cause it to slow down or stop insulin production altogether. Both these scenarios result in too much sugar circulating in the blood, a condition known as hyperglycemia. Over time, this excess sugar can cause serious damage to various organs of the body, including the heart, kidneys, eyes, and nerves. This inability of the body to regulate blood sugar levels and the resulting high sugar levels in the blood is what we know as diabetes. While it may seem daunting, understanding this disease is the first step towards managing it effectively. So we've just understood that diabetes is a chronic disease that affects the way our body uses energy from food, involving issues with insulin production or function. It's not just about having an insatiable sweet tooth, but a more complex interplay of insulin and glucose in our body. Now that we know what diabetes is, it's crucial to understand its types. Did you know there are several types of diabetes? Let's delve into the three major types: type 1, type 2, and gestational diabetes. Each has its unique characteristics and impacts the body differently, but they all share a commonality: an issue with insulin, a hormone crucial for regulating blood sugar. First, we have type 1 diabetes, formerly known as juvenile diabetes, since it's often diagnosed in children and young adults. It's an autoimmune condition where the body's immune system attacks and destroys the insulin-producing cells in the pancreas. The result? The body can't produce insulin. Without insulin, sugar builds up in the bloodstream instead of being used for energy. People with type 1 diabetes must take insulin every day to survive. Next, we have the most common form, type 2 diabetes. This occurs when your body becomes resistant to insulin or when the pancreas can't produce enough insulin to keep up. Instead of moving into your cells, sugar builds up in your bloodstream. While it can occur at any age, type 2 diabetes is more common in people over 45 and those who are overweight or inactive. Unlike type 1, lifestyle changes can significantly influence the management of type 2 diabetes. Lastly, we have gestational diabetes. This type occurs in some women during pregnancy. Like the other types, gestational diabetes leads to high blood sugar that can affect pregnancy and the baby's health. However, it usually resolves after childbirth. But it's worth noting that if you've had gestational diabetes, you're more likely to develop type 2 diabetes later in life. It's crucial to remember that while these types of diabetes differ in causes and risk factors, they can all lead to serious health complications if not managed. They share some common symptoms such as frequent urination, unquenchable thirst, unexplained weight loss, and constant fatigue. Each type of diabetes has distinct characteristics, but they all share common symptoms. How would you know if you have diabetes? What are the warning signs? Many people grapple with these questions, and it's vital to be aware of the answers. Diabetes, a significantly prevalent condition, often unveils itself through a series of common symptoms. Recognizing these signs could be the first step towards managing or even reversing this condition. Let's dive into some of these symptoms. Frequent urination or polyuria is one of the most common signs of diabetes. Your kidneys go into overdrive to get rid of the extra glucose in your blood, and that can lead to more trips to the bathroom than you're used to. Closely linked to this is another common symptom: increased thirst. This is your body's response to the increased urination. As you lose more fluids, your body tries to replenish them, leading to a constant feeling of thirst. This is often accompanied by a dry mouth and itchy skin. Unexplained weight loss is another red flag. Despite eating the same or even more food, you might find your weight dropping without any apparent reason. This happens because your body isn't able to get energy from the food you eat due to insufficient insulin. As a result, it starts burning fat and muscle for energy, leading to weight loss. Other symptoms to look out for include constant fatigue, increased hunger, blurred vision, slow healing wounds, and frequent infections. Although these symptoms might seem common or even trivial, they can be indicators of a much larger issue. It's crucial to pay attention to these changes in your body and consult a healthcare professional if you notice any of these signs. Remember, early detection plays a pivotal role in managing diabetes. It gives you the chance to take control of your health and make lifestyle changes that can prevent the condition from escalating. Recognizing these symptoms could lead to early diagnosis, but what happens next? Stay tuned as we discuss the next steps after a diabetes diagnosis in the following scene. So, you've been diagnosed with diabetes. What are your options? Let's dive right into it. Living with diabetes doesn't mean your life is over. It's simply a new chapter that calls for some adjustments. The best approach to managing diabetes is a combination of lifestyle changes, medication, and in some cases, insulin therapy. First and foremost, lifestyle changes are key. This involves adopting a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Try to limit your intake of processed foods and sugary drinks, as they can cause your blood sugar levels to spike. It's not about depriving yourself, but about making smarter food choices. Regular exercise is another cornerstone of diabetes management. Aim for at least 30 minutes of moderate intensity exercise, like brisk walking, swimming, or cycling most days of the week. Exercise not only helps control blood sugar levels, but also reduces the risk of heart disease, a common complication of diabetes. Now, let's talk about medication. Depending on the type of diabetes you have and its severity, your doctor might recommend oral medication or insulin injections. Oral medications for diabetes work in various ways. Some help your pancreas produce more insulin, while others reduce the amount of glucose released by your liver. Insulin therapy, on the other hand, is often used when the body cannot produce any insulin, as in the case of type 1 diabetes. There are different types of insulin, varying in how quickly they start to work and how long their effects last. Your doctor will help you decide which is best for you. Remember, regular monitoring of your blood sugar levels is crucial in managing diabetes effectively. It helps you understand how your diet, exercise, and medication affect your glucose levels and allows you to make necessary adjustments. Lastly, having a solid support system is invaluable. Surround yourself with people who understand your condition and can provide emotional support. With proper management, people with diabetes can lead healthy and fulfilling lives. It may seem challenging at first, but with time, patience, and consistency, you'll find your stride. Let's take a moment to recap what we've learned about diabetes. We started off by unraveling the enigma of diabetes, a chronic condition that affects the way our bodies process sugar. We learned that it's not a one-size-fits-all disease, but rather it comes in various forms. Type 1, Type 2, and gestational diabetes each have their unique characteristics and risk factors. Moving on, we delved into the symptoms of diabetes, a crucial aspect of early detection. Frequent urination, increased thirst, and unexplained weight loss are just a few signs that should prompt you to seek medical advice. And let's not forget about the treatments. From lifestyle changes such as healthy eating and regular physical activity to medication and insulin therapy, there are numerous ways to manage diabetes and maintain a high quality of life. Remember, knowledge is power. Understanding diabetes is the first step towards managing it effectively.